I know him personally for last, I think, at least 3 to 4 decades. It has been very nice to be working with him on various projects. Now, so we will now, I think, because he was not live, so we had recorded his session. So Dr. Jyoti, we'll see now Dr. Jothydev.
From Trivandrum, from Kerala.
Yeah.
First of all, let me express my sincere gratitude to Dr. Kunango sir, A.K. Das sir, and Jayant Kumar Panda for giving me one more opportunity. Let me start sharing my slides. And this is a lecture on continuous glucose monitoring, TIR, and the new digital tools for managing diabetes. Of course, this is related to technology, and I don't have anything to disclose pertaining to this lecture. In the last 1 decade, we, the diabetologists, physicians, and endocrinologists, we have witnessed the launch of more than 24 new drugs for diabetes. But the question remains, did those drugs make a difference in the outcomes? Of course, there has been phenomenal changes in the outcomes, but with respect to the hemoglobin A1C and the average hemoglobin A1C globally and within India, it is still remaining very close to 9%. So the newer therapies by itself is not a solution, and still millions are developing the avoidable complications of diabetes. And this is adding on to the burden of treating diabetes. And the solution, according to the global authorities for a better outcome in diabetes, is the intelligent integration of technologies in diabetes. Technologies in diabetes can be broadly divided into technologies for monitoring and technologies for insulin infusion. So I will be discussing both, since the technologies for insulin infusion are also related to monitoring the glucose. So let us look at the data of a doctor who belongs to our own community, our own fraternity, and he is 47 years old, 3 years of diabetes, is definitely obese, with an A1C of 8.8%. So obviously, it is very high, and he is on the following medications. He is on biphasic analog insulin, he is on metformin, glimepiride, he is on a gliflozin. And during the interview, he said, I am also a doctor like you, and I am very busy traveling. I have to teach my students. I have to go for rounds at least twice a day, and I cannot adhere to the instructions on monitoring. I have started using a glucose meter, but I cannot. It is not possible for me to adhere to the instructions on monitoring diet or exercise. And somehow we convinced him on the use of a continuous glucose monitoring. And we did it because we thought that let us be more practical. Let us be more realistic in bringing better targets for him. And we observed him for 3 months. And this is at the end of 3 months, the hemoglobin A1C has come down from 8.8% to 6.8%. And this is 90-day TIR, it is 98%. So it's good. So let me now move on to the connected glucose meter. So whenever we discuss about technologies in diabetes, we have to touch upon all those modalities. The connected glucose meters have been around for more than 8 years now, and they are the glucose meters which connects to the mobile health application via Bluetooth. And for the ordinary man who cannot afford a continuous glucose monitoring device, of course, this is the solution. And this is a solution, and some of these MI applications such as My Sugar, they have a plethora of additional values. And this is the green monster, which responds to your touch, your glucose levels. You can log in your vitals. You can take a picture of the food and then upload it. And the entire information on the oral medications, the injectables available in the market, all of them are available in the mHealth application. So this can be considered as a partner in diabetes care, as a coach in diabetes care. And there are a couple of branded glucose meters which are the connected meters. So let me now move on to the current status of continuous glucose monitoring. This is important. Although there are multiple classifications available, this is the simplest classification for CGM. Number one, it can be a blinded CGM where the patient can deploy at the doctor's office, come back after 7 days or 14 days to download the information. Or it can be an intermittently scanned CGM where you can scan either with an NFC-enabled phone like this, or you can scan with a reader. And whenever you scan, you will get the interstitial glucose value. Unlike intermittently scan, a real-time CGM will display the glucose levels all the time. And it keeps on changing once in every 5 minutes or once in every minute, depending upon the make of the CGM. Integrated CGM is currently not available in India. Integrated CGM is an open interface where the sensor can be wirelessly connected to a third-party application such as a mHealth application, the phone, a dosing algorithm, or with another insulin pump for automation. And these are the three popular devices in India. The Guardian Connect, which is a real-time CGM, the Libre Pro, which is the professional CGM, and the Libre, which is the most popular CGM globally, number one CGM globally, and that's the intermittently scanned CGM, which is relatively inexpensive when compared to the other CGMs globally available. And this is from Dr. Benshi Sabu and the team, strongly recommending the use of time in range as a target in type 2 diabetes. And this is an urgent need. Of course, continuous glucose monitoring is the recommendation for type 1 diabetes, for insulin users. But in type 2 diabetes as well, if you are looking for an option to prevent the avoidable vascular complications, this is the solution. This is the technology solution. And for the last 25 to 30 days, in India, we do have the digital tools. And this is the Libre link up in the mobile phone. And this is from my own phone, where I can open the Libre link app and I can click on the scan button, and then I can scan my sensor. And the sensor will immediately
148 milligrams per day.
Report. So this is how the TIR will look like between 70 and 180, 98% of the time. And I can share this information with up to 20 more people in real time. And that is with the Libre Link Up app. So you can ask the bystander or the family member or the dedicated staff who can be a nurse or a diabetes educator to download Libre Link Up app. But in the hospital, when you have thousands or hundreds of patients on sensors, this is a solution. The LibreView.com, and this is a cloud-based diabetes management solution where the entire patients will be, you can see the data is populated. I can click on a particular patient and view, and I can generate the CGM metrics. And this is a rule of the day, the CGM metrics, which is now complementary to the conventional metrics for glucose management. And if a doctor friend is questioning you, why are you introducing a new metric when I'm happy with my glucose meter, when I'm happy with the hemoglobin A1C, which is providing a 3 months average? This is the answer. 3 beautiful girls over there with exactly the same hemoglobin A1C of 7%. All the 3 of them are having the same A1C of 7%. But look at the glucose variability. There are significant differences between them. For the third girl, despite an A1C of 7, it is 100% time between 70 and 180. Whereas for the girl on the left, it is only 40% time which is within the range. And 20% it is below and 40% it is high. No wonder millions of our patients, despite a near normal A1C, tends to develop vascular complications of diabetes. And this also is an explanation why the patients are developing or they are exhibiting mood swings, they are having the complaints of energy, low level of energy, and so on. So this is going to have a direct impact on the quality of life. Though this is a very familiar slide and all of you are masters of TIR metrics, but there could be at least one or two doctors who are listening to me who will have some benefit on reviewing the same data. This is international consensus and this is a very, very important slide. For people with diabetes, type 1 and type 2, with relatively less complications, you have the aim for a TIR more than 70%. And 70% translates to 17 hours in 24 hours. And this is level 1 hypo below 70 and level 2 hypo below 54. And this is less than 4% and less than 1% respectively. 1% corresponds to 15 minutes in 24 hours. And you can see that in the presence of complications, irrespective of the age, you probably need to target only more than 50% in range, because the hypo-induced consequences could be more worrisome. In the presence of GDM or type 2 diabetes, be very aggressive, more than 90% or 95% within range. But remember, the lower limit of 70 is replaced by 63, and the upper limit of 180 milligrams per deciliter is replaced by 140 in the presence of pregnancy. And this is the frequency of repeating continuous glucose monitoring, the South Asian recommendations from our group representing multiple countries. Again, very important. Even when diabetes is within control, even when the TR metrics are within the acceptable limits, you have to repeat the CGM at least once in every 6 months. However, if they are exceeding the recommendations, the time below range is more than 4 or more than 5%, based on the clinical judgment and the affordability of the patient, we have to repeat it more frequently, once in 3 months and once in 2 months. And this is a recommendation on intermittently scanned use of continuous glucose monitoring, intermittently scanned continuous glucose monitoring if the patients cannot afford for a continuous use. And this is the broader view of the ambulatory glucose profile report consisting of TR metrics, the AGP graph, and also the daily graph. And this is the evolution of insulin delivery devices over the past, I would say, 100 years. And now, with the availability of more reliable and affordable continuous glucose monitoring devices, automation is no longer a dream. And these are the 3 popular advanced hybrid closed-loop systems available globally, of which only 780G is available in our country. And this is capable of adjusting the insulin delivery once in every 5 minutes, both basal and border. So when insulin is needed more in the presence of hyperglycemia or impending hyperglycemia, based on sensor glucose levels, the insulin infusion automatically increases. And these are the patient responses. Ever since the diagnosis of type 1 diabetes, I have slept peacefully at night continuously for 8 hours. And this is no longer a dream. And most of the patients on 780G, even today we are having an admission for a 780G deployment, and most of them are having a TIR consistently above 90%. That is also exceeding the recommendations. And these were all possible only because of the newer generation of continuous glucose monitoring devices. And this is DIY artificial pancreas, one of our own reviews, which is referred to by all the major scientific organizations in their yearly guidelines. In India also, the space is expanding. Patients and the caregivers and the relatives and also the doctors along with the engineers. And we are expanding the space for digital health and diabetes. And this is Dr. Mohan on the current status in India. Every time we discuss about technologies in diabetes, the question is, isn't it expensive? And this is the answer. When you're using a continuous glucose monitoring device or an automated insulin delivery device, it is associated with, for example, 780G, an incremental gain of 1.95 quality adjusted life years compared to conventional management of diabetes. Use of technologies invariably reduce the cost of diabetes care. Telemedicine, smartphone with mobile health applications, and remote monitoring. And with every complication, there is an escalating cost in diabetes care. Earlier, we used to teach our doctors. When I was a teacher in the medical school, I also used to teach. The complications of diabetes is related to duration of diabetes. It's no longer true. Almost all of them are preventable if you are intelligent in the use of technologies. The accidents are avoidable, provided you are choosing the right technology and suggesting the right technology for your patients. The life is going to be much more easier for not only the patients, but also for the doctors. And this is an invitation to the World Congress of Diabetes and Diabetes Technology and Therapeutics. Some of you may be aware of DTEC, and the next DTECon is going to be this year, 2024, in Kerala, in Kochi. Please get registered, and this is going to be an exclusive technology congress for diabetes. Thank you very much, Dr. Kurengo sir and the team, for inviting me and giving me this opportunity.